All right, question for you. Does your child have allergies? If so, you're not alone and they're not alone. Allergies do seem to be increasing in children.
Yeah, you hear about it all the time, but there is a new treatment that could help. Holly went to Akron Children's Hospital to learn more. Take a look.
I'm talking to Dr. Brian Schroer at the Akron Children's Hospital about the prevalence of food allergies, and it seems like it's all you hear about these days, Doctor. What are we seeing as far as prevalence these days?
Yeah, it's very clear that the prevalence of food allergies, the rate at which our kids develop food allergies, is increasing as the years go on. So currently we're seeing about 8 to 10% of kids who have the potential to have an anaphylactic type reaction to foods.
Tell me about immunotherapy. What is that and how could it be useful for food allergies?
So in kids who already have developed some food allergy, be it peanut or egg or milk, there is now the potential that a therapy could be used to treat that food allergy. It's something that has not been very commonly done in the past, but it's becoming more and more prevalent.
Okay. What does the research actually show about this kind of treatment?
Right, so the oral immunotherapy to foods is currently being studied in a way that it's trying to figure out both the benefits and the risks. What we know so far is that, at least for certain foods, there's clear evidence that doing food immunotherapy decreases the risk for the kids who are on the therapy for having a severe reaction if they accidentally eat the food. It's not quite as clear that most patients who do this therapy ever, quote, outgrow the allergy. So right now, the thought is that this type of therapy, if it's done, in most patients is going to have to be a lifelong type of therapy.
Yeah.
In some patients, after 3 to 5 years, they might be able to stop the therapy and then eat the food ad lib or as they desire and not end up with another reaction.
So it gives hope.
It is a hope
Yeah.
for a situation where we really didn't have much to offer besides food avoidance and recognize and treat a reaction if and when a reaction occurred.
As a parent myself, and I think a lot of parents feel this way, we went to school and peanut butter and jelly was never an issue. It seems like there is such a high amount of it happening. Is there a reason for that?
Yeah, it's really not very well known exactly why there's more food allergies now than there were in the past. It's certainly multifactorial and it doesn't have anything to do with one particular thing such as processed foods or GMOs. It really is this factor where the people who develop food allergies have a genetic predisposition, and then there's a lot of things in our environment, especially in the westernized worlds like America or Europe or Australia, where food allergies are pretty prevalent. Something in that type of environment in the westernized societies that allows our kids to become allergic to things like eggs, milk, peanuts, tree nuts, and things like that.
Yeah. And advice for parents as far as trying to avoid developing one of these allergies, would you recommend, introducing things like peanuts to your children?
Yeah, absolutely. When it comes to the food oral immunotherapy, that's really meant to treat patients who are already diagnosed. But wouldn't it be nice if it could prevent the kid from developing a food allergy in the first place? Very clear evidence in multiple studies, both for peanut and now for egg, and studies are being done for milk and other foods, that if you have a kid who has the potential to develop food allergy, and those would be kids with, say, eczema or already have another food allergy, it's clear that if you want to prevent the development of an allergy to a food, you want to give that child the food. That means if they're not already allergic, eating the peanut or eating tree nuts or eggs or milk is currently the main recommendation to try and prevent that kid from becoming allergic in the first place.
Doctor, thank you so much for sitting down and taking the time today.
Absolutely, glad to have it. Thanks for having me.
That's fascinating.
Great information. I got my daughter tested, who's 3, and it was recommended, and now we know, and she doesn't have any, but it's good, I think, just to get the kids tested.
Absolutely,
So
and it sounds too like it might not be a bad idea either to introduce perhaps some of those foods earlier on.
Right, that's what we're hearing now.
Yeah, that's so interesting. We could have that. We could totally have him on for like the next hour and talk all about that.
Yeah.
But we have some really cool stuff coming up.
Yes, a set of a spooktacular dining table is coming up.
I know, look at that. Well, you know who's in town? Miss Kristen Gambasini is going to show us how. Coming up right after this.
This segment of Live on Lakeside is sponsored by Akron Children's Hospital.